55-year-old male presenting with dyspnea. There was a 25 centimeter lung mass, and this is the needle biopsy of that mass. So this part of the needle shows a glandular lesion. If you look between the glands, though, there are some bland spindled cells, and it looks like the spindle cell process is probably part of this neoplastic process. Here you can see the glandular component. This is almost pure glandular differentiation in this area. Here we've got glands, and you're starting to see a more prominent spindle cell component. There is cytologic atypia present. Here you can kind of see the transition in this needle from the predominantly glandular component to this monotonous, highly cellular spindle cell component. Here again is some glands and a few spindle cells. And if you just had this, there's probably some things you'd be thinking about in the differential diagnosis here, but this is a fairly characteristic pattern for synovial sarcoma. Highly cellular, nucleus almost on nucleus, and some mild cytologic atypia. This shows the pretty characteristic nuclear features of monophasic synovial sarcoma. So they've done a keratin on this case, and as you can see, there is some focal keratin staining in the spindle cell component, which is fairly characteristic of synovial sarcoma. Sometimes you even see less staining than this. Here's another area showing, I think, real keratin staining. And as you would expect, the glandular component was strongly positive for keratin. So this was a biphasic synovial sarcoma. Most of the people that responded thought this was synovial sarcoma. Carcinal sarcoma would be really unusual in the lung. I think in that setting, the glandular component usually is much more malignant looking. With biphasic synovial sarcomas, the glandular component is really pretty well differentiated. There's a nice article that I found talking about primary pulmonary synovial sarcomas. This article looks at 60 cases and also summarizes the literature. There are some unusual histologic features that you can sometimes see in pulmonary synovial sarcomas. One thing in soft tissue synovial sarcomas, you quite often get a lot of calcification. That feature is not really present in pulmonary synovial sarcoma. And in this series, only 12% were biphasic. Most of them are monophasic synovial sarcoma.